talking about foot, ankle, low leg today. Okay, a few things we're going over in the ankle, common injuries that you're going to come across as far as the low leg too. A little bit of the low leg will be repetitive stuff. Get through it. Okay, acute compartment syndrome. This is where, so you have your compartments in your low leg, and the anterior compartment is comprised of the 4 different muscle groups and also some nerves in there too. And sometimes you can get a direct blow to your low leg, and it can cause a lot of swelling in that anterior compartment. And that anterior compartment isn't allowed to expand because that fascia keeps everything kind of in place. It keeps your extensor hallucis longus, digitorum longus, peroneus longus, and peroneus brevis. So since that fascia covers it, it doesn't have a lot of room for expansion, and those muscles start to swell, which causes an increased pressure in that compartment. And that's a medical emergency because that can cause further muscle damage and nerve problems as well. So it causes the decrease in blood flow to the muscle. They are going to present with a lot of swelling, and the swelling will be from below the knee all the way into the ankle. Also numbness, tingling, burning as well. So if they are looking, if they have the mechanism of getting hit, I know something common has happened like in baseball where they'll get a ball to the shin, and if it's just completely swollen in the whole leg, whole ankle, send them, call the EMS. Okay, so this is where they open up. What they'll do whenever you get them to the ER is they'll do a fascia release, and they'll just go in and kind of release that fascia and let the muscles swell themselves and end up sewing them back together. Yeah, I guess not the funnest thing. Okay, so exercise-related low leg pain. You can have tibial periosteitis, and that is just where, that's the same thing as shin splints pretty much. Just the repetitive stress on the low leg, on the tibia. And remember, we go back to shin splints is where you always want to make sure you can localize the pain. So with the MTSS, it's going to come off as generalized pain up and down the shin, and then what you want to do is make sure you control those symptoms, figure out what's causing it, what they're doing wrong in their exercise routine, and then try to prevent that from getting any further. Because like we talked about earlier, it can lead to stress fracture, which is not good. And then they're done for about 6 weeks or more. Okay. And then chronic exertional compartment syndrome. That is the same thing, similar to acute compartment syndrome, except it's just caused from an ongoing period of time. And that's just same kind of results. Like they'll swell during activity, they'll have pain, numbness a little bit. Sometimes when they're sleeping at night, it'll swell up as well. And that can be mistaken for MTSS, so you kind of want to rule those out and try and differentiate which is which. And with chronic exertional compartment syndrome, it's not a medical emergency like acute compartment syndrome because the muscles aren't expanding so much from like an acute impact. It's just they're swelling a lot, which is causing that pain. But you can go in and they can do a fascia release as well. Usually that won't happen until postseason kind of thing. They're not gonna do it immediate in the season. So, going on again with this, so activities that cause repetitive motions, running, hurdles, along those lines. And so they will have difficulty moving the foot, visible muscle bulge. You can reduce the activity if you want, maybe look at what they're impacting and try and rule out any other conditions such as stress fracture or shin splints. Something you can do to reduce the activity is have them cross-train or look at what the surfaces they're running on and okay. That's just exercise-related low leg pain. You're going to be looking at their biomechanics as to what they're doing wrong. Are they pronating or are they supinating excessively? What's the difference between pronation and supination? Shows it. Show me.
Pushing off the top.
Yeah. So yeah, you're okay. And then training changes also you want to look at for the different surfaces they're running on, the intensity. Are they starting out going from not practicing at all to ramping up their mileage really fast, or starting a lot of pounding really fast? The type of exercises they're doing, are they doing them correctly? And also the shoes and equipment. Shoes is a big deal, especially if you're looking at runners, which is the most common you'll see this in, and you want to make sure that they keep up with their shoes. They're not wearing their shoes for a year and a half and coming complaining to you about little leg pain. I mean, we had someone come in the other day and they're having pretty bad shin splints, and you look at their shoes and they have like a hole at the top of it, and then half of their shoes like worn down in certain spots. Hole's probably going to form at the bottom, and ask him how long he's had his shoes, and he says a year and a half, and he's a mid-distance runner, so doesn't really make much sense. So general rule of thumb is just about, with your running athletes, you want to have them change their shoes out every 6 months.
Pronation. This describes a work pattern where the foot lands about 15 degrees inward at foot stroke. The heel strikes, the foot comes down and forms a stable platform on the ground, and then the runner pushes off slightly from the big toe. Here, you see a normal pronator running on a treadmill. She's turning over pretty quick, but you can see that there's not a lot of wasted motion. If we slow it down some, you can see that when she reaches the end of her stride, her forefoot is angled away from her body just slightly. When she pulls her leg forward to take the next step, notice how her foot rolls inward. When she lands, there's a slight angle, but just a slight angle, from the side of her foot to her lower leg. As she steps forward through the gait cycle, notice that all of her weight is going forward. Normal pronators usually have normal arches. Another way to check your pronation is to take a look at the bottom of an old pair of running shoes. A normal pronator will have relatively even wear along the heel and under the ball of the foot. Normal pronators usually have an efficient stride and can run in many types of running shoes, but having the skate pattern doesn't mean that your stride is perfect. You may need a slight stability shoe or some cushioning, depending on your size and weight.
And if you're in a setting to where you have access to a podiatrist or someone who fits orthotics, you can have them come in and get your athletes all fitted for orthotics. But that's if you have the funding to. You see that more at the big D1 schools. Okay.
What?
So he probably has some issues. You guys get these raining downhill? What kind of problems could this predispose you to when you have this kind of pronation? Low back TV in? What else?
Stress fracture,
Stress fracture? Yeah.
potentially.
Yeah.
Knee problems.
Subtalar joint problems.
Subtalar
Joint
problems.
problems.
Yeah. Probably a little bit of ankle instability too. Those medial ligaments. See right there, they're evaluating his hips.
It's not much of
The key point he's trying to get across is that the body's a kinetic chain, so just by pronating that much, you can get pain all the way up and down.
And then he's about to make contact with the floor, like in
Just depending on what he's compensating.
See, he like inverts, and then foot goes like that.
Number one.